Hello everyone, hope you all are doing well and utilizing Know Your Calling at your best. And today we have special guest Pankaj Singhai sir, who is currently assistant professor and consultant in charge in the Department of Palliative and Supportive Medicine at Sri Aurobindo Medical College, Indore, Madhya Pradesh. And sir have many great achievements and awards in the field of palliative medicine. And sir has won the gold medal in the competition of Bruce Davis competition. Sir has completed his MBBS from GR Medical College, Gwalior, and sir has completed his MD in palliative medicine, Tata Memorial Hospital, Indore. And so we are welcoming you, sir, in this beautiful session, and I will welcoming you.
Thank you so much, Dr. Vidit. Thank you for giving this opportunity to talk about palliative care. Uh, yeah.
Yes, sir. So, sir, let's start with the general introduction about the branch in the palliative medicine, and what is your thought in this?
Yeah. So palliative medicine, maybe many of you might not be aware about. So I will give a very brief overview of what is palliative medicine. Maybe in final year of your MBBS in medicine or surgery, you might have heard a little word palliative. So
Yes.
as the word says, palliative means to block or to care. It mainly to provide comfort in patients who has very advanced illnesses or very
Yes.
serious suffering when diseases are associated with. So it is not only for cancers, it is not only for end of life care, but it is for those situations where patients or their family members are suffering. We do a lot of things, medical interventions, non-medical interventions, to bring their quality of life back and to reduce their suffering. We will be talking more about this branch in between also. Yeah.
Yes. Sir, what is the main things you love in this being the branch in the palliative medicine?
Okay, so I feel the best part of this medicine, this branch of medicine, is the empathy associated with it, the emotions or the humanity part of medicine. So that is, I think, the best part. We are doing all the medicine work. We are applying all our knowledge of medicine, but
Yes.
that we are the humanity part of it is also associated. A lot of communication, a lot of teamwork, a lot of leadership
Yes.
is associated. So I think that's the one thing that is best in this branch. But there are a lot of other things which could be a good thing. Uh,
Okay, okay, sir. Okay. These things I should not have been asked about the particular branch, about the cons of any specialty. So, what is your thought about the being in a specialist in the palliative medicine? Is there any cons we can expect?
Cons. Okay. So, as you know, patients in this branch, they are suffering quite a lot. So there are
Yes.
pros and cons, both are there, and we need to have a balanced thought when we are choosing a career into this branch. So, first, I tell you more pros because
Yes.
otherwise I will not do the justice. So there are a lot of advantages which you feel if you are into palliative care, you will get. The one and most attractive thing is right now there are not many specialists in this branch. So there is a lot of career opportunity. Another thing in research, there are a lot of things coming up in research work. So if you like to work in research or you want to go abroad, especially
Yes.
in European countries or Australia, US, then there is ample of opportunity in this branch. Third thing, because there are not many people, you will be on the top. Means everyone in this country will be knowing you among each others. So if you are joining at this stage, uh, in next 5 years or 7 years, you will be leading this branch. So these all things are pros of this branch, but there are some cons also. The other side of palliative care. Uh, Unfortunately, maybe means this is the core thing of this branch is that we will be dealing with those people who doesn't have many days of their life. They may be there with you for few days, few months, or few years also.
Yes.
Uh, that is the one thing. Like you will be dealing with people who may be dying. Another thing about this branch is the monetary issue. Like it's not a branch where you will have endless money because people usually do not want to spend quite a lot at this moment of time. Uh, Third thing is not many people like to talk a lot. Means they want to do the procedures, they want to see the results, and then moving on to next patient. Here, what we need to remember is you will be dealing with them with their emotions. You need to, means your patients may be crying in front of you, and many a times there may not be any words which can help them. So these all things, like you need good soft skills in this branch. So if you feel like you do some interventions and if you get the instant result, that is not there with this branch. So yeah.
Okay, okay, sir. I can totally relate with your things too. So sorry to interrupt you, but your camera is not
Oh,
visible to my end.
all right. Okay. Is it?
Yeah. Yes, 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 yes. Actually, sir, I am relating with your stories and the things you just told about the cons about the branch. And sir, you just talk about the pros of being the specialty in the palliative care, and you just spark the light about the monetary aspects. What are the things we can expect in the future?
Okay. Yeah. So currently, what means I passed my MD from Tata Memorial Hospital in 2017. After that, I
Yes.
was a senior resident in Tata Memorial, and then I moved to Manipal. When I moved to Manipal as assistant professor,
Hmm.
I used to get a decent salary, which was more than like 70% of my batchmates who were doing
Okay.
surgeries or medicine or pediatrics or obstetrics. So
Hmm.
means I was earning
The same.
a satisfactory level. Then I moved because of some family reason. I moved back to Madhya
Yes.
Pradesh. Here also, finding job was not difficult. Luckily, I went to the first hospital because I am interested in academic thing. So I
Okay.
went to the medical college, and the same day they hired me. So it was not difficult, and the salary was also decent. Means I'm earning
Yes.
more than what my most of my colleagues in medical colleges are earning. But there is another side here also. Not everyone wants to work in academic
Yes.
institute or
Yes.
institute. So
Definitely.
if you want to work in as your private practice or an institution where they ask for revenue 10 times of your salary, then it might be a bit difficult. Means because not many people understand this concept.
Yes.
Especially the problem is from your medical colleagues, like your physician or the medical oncologist or neurologist may not understand what is palliative care.
Yes.
So it may take some time, or you need to do a good publicity at that point of time. But yeah, as I said earlier, not many people are there in this branch. So you will be, maybe you will be the first one in your city or in your area. So that may not be very difficult.
I can just expect that if the new students are just expecting that we want to take a specialty in the palliative medicine, they can just go and settle very early.
Yes, yes, means if you see, means there are a vacancy portal on our Indian Association of Palliative Care. Almost 90% of those institutes are still vacant, means they are not finding junior consultants or assistant professors. And because hardly 30 people passes out, or not 30 also, means right now 10 or 12 people pass out every year. Now there
So,
are PNB seats or new medical colleges have started, MD
mhm.
medicine. So maybe when you will pass out, 30 or 40 people will come out every year. But that is also not sufficient. So instantly you will get job. Uh,
Sir,
but,
yes, sir, please continue.
but that will be mostly in tier one cities like Delhi, Bangalore, Hyderabad, Chennai, or uh, or some tier two cities. But I hope with the discussion, what is happening with government and all, maybe most of medical college will have department of palliative medicine. But right now that is not the situations. But
Yes.
a lot of corporate institutes, a lot of medical colleges, they want to start palliative medicine department. So at least for next 10 years, means whoever is joining palliative medicine, they will be absorbed instantaneously.
So you just share the facts about the being in the specialty. I just want to take one thing in this part. What is the lag period we can expect to settle in the like if individual doing just government job, individual want to settle with the corporate job, and individual want to settle with the private job. So what is the things we can expect in the future, like after 5 to 10 years down the line?
Okay, so if you want to settle in private, most of good cancer centers, they will definitely, means as you pass out, they would
Yes.
be talking to you to join their institute. But that's not there if you want to settle in tier two cities or tier one city, tier three cities.
Yes.
You might struggle a little bit. Means it might take a good 6 months to 1 year also to have a good number of patients, because you need to publicize yourself. You need to tell people like this is the concept of pain management.
Yes.
But that word of mouth publicity spreads quite fast, and your patients, your referring doctors will be telling other people also that he is the palliative care physician, and he can do a lot of wonders to our patients. So that is one thing with the emerging branches, that
Yes.
there's no new concept.
If
Talking
anyway, yes, sir,
government
please.
thing, if there is vacancy, then yeah, definitely you can join at the same time. But if like in Madhya Pradesh or Chhattisgarh, no government institutes have palliative care vacancies. So if you want to settle in government, then you have to talk to the deans or in the government
Yes.
ministries and all to get those seats. So that may be a difficult part, but like in Hyderabad or Telangana, in Kerala, Maharashtra, the medical colleges are also starting, the government medical colleges are also starting these things. So it's easy to settle down in those cities.
I think there will be not a much problem in the current scenario we can expect in the job, as you are telling.
Definitely, for next 10 years, people will not suffer.
Oh, so I'm just eagerly to know about your residency life and what was your residency life.
Oh, residency life was amazing. Means I was in Tata Memorial between 2014 to 2018. I was the third batch to join palliative medicine.
Yes.
Before me, there were two batches were there, but no one passed out. So we were a very small people, like two seniors, two super seniors, and two of
You.
us. So only
Hmm.
six people. Tata Memorial Hospital is a big institute. It has its name and fame, and also they are very supportive for palliative for their residents also. Not like they will not give you a lot of work; they will take a lot of work from you, but at the same time they will give you ample of opportunity to learn, to do research. I will divide my residency in three parts. One on the
Yes.
clinical work, second was about the research and academics, and third the life like how the residency life was. So
Yes.
first about the clinical work. So we had daily OPDs. It was not like unit system that one unit will work and then the next unit. No, not like that. You will have to do daily OPD. Sometimes you have to go for home cares also. That may be twice a month for home care. And then you will have a alternate day emergency duty, because we were only two of us. So you
Yes.
have to be on emergency duties. It was not that hectic that time, but now I heard that it is quite hectic. The emergency duties
With
also.
that influence.
Yes, yes. So we enjoyed quite a lot. The best thing with palliative medicine are people, whoever is working, they are usually very kind-hearted. So your consultants, like was going very are very supportive. You won't believe me. If you don't know who is your HOD, and they will be sitting in a hall, you don't know who is the resident and who is your HOD,
Yes. I
because
can
the kind of bond that is there in these departments, and it's everywhere. Like it's same in AIMS, same is in St. John or in Tata Memorial. So that supportive environment is always there. We enjoyed quite a lot, because there is a good means work and life balance is there. So we enjoyed quite a lot. That was about
really.
clinical work.
Yes.
About the academics and research, means you will have a good academics. Your teachers tries to teach you a good things. Then about the research thing, you get a very good opportunity. Means for my thesis, I got grant in lakhs from my institute for
Yes.
research, because there is not much research in palliative care. I twice I got international travel grant uh, to present my thesis work. So those things means you will get a good opportunities for research. And then the like academics and India, I told you. So these are the thing about the residency.
Actually, I can feel the work-life balance totally equally where there in your residency. And sir, I am just excited. Is you were just describing about the life of being resident in your time. So, is the branch palliative medicine we can get free time for researches? We can get free time for our hobbies to work on.
Yeah, so definitely your consultant or your teachers promote you to do the research. And the good thing is not your teacher will not publish your research by their own name.
Yes.
You will be the first author for your research. That's the advantage we get in palliative care. They will be the corresponding authors or associated authors, but it will be in your name. They will ask you to do a lot of research, and yes, you get that time. Like in Tata Memorial, we get Saturdays for only for academics and research. And like we enjoy a Saturday, maybe other people in Tata Memorial, you will get to know. So there is only half day working and half day is dedicated for research and academics. Similarly, in other institutes also. So
Okay, so totally maintaining the work-life balance with our academics and totally possible with our hobbies to learn all the things in one place. I can get it from your things. And sir, I want to ask just next thing is that what are the future options in the foreign countries if any individual want to see a future consultant in foreign, like they want to go USA, UK, or other countries?
okay, so Miss, in these countries also there are a lot of vacancies are also there, and a lot of Indian people are working in palliative care, and they like in Middle East, in European countries, US and Australia. If you want to settle in any of these countries, means you will get a good opportunities there. There are certain exams which you need to pass out, like USMLEs, or there's some medical specialty course in Europe that you need to pass out. But with your academic background and with your research publications and all, it's much easier. And sorry, I forgot to mention Canada also. Canada also promotes a lot of palliative care research, and they need consultants. So few of our, like my senior currently is a fellow in one of the largest cancer center in Canada. Few of our colleagues from AIMS has gone to US, and one of my seniors is in Middle East country also. So I can say like a lot of people, a lot of opportunities there.
So, sir, after doing MD in palliative medicine, is there any subspecialty or super specialization we can get?
Okay, so as such, palliative medicine is also and branch. You don't need super specialty or sub specialty, but if you are interested, there are some fellowships or courses, like these are maybe short-term courses. So if you want to go into neuro palliative care or renal palliative care or pediatric palliative care or interventional pain. So these are a few subspecialties of palliative care where you can go. Interventional pain thing, there are few institutes only which offer it for palliative care. Otherwise, most of other institutes they ask anesthesia background, but that's mainly because not many people are aware about palliative medicine. But slowly, maybe palliative medicine people will also be eligible for intervention pain in almost all institutes.
Okay, so this was I have not asked this question also for you. Like any gender difference in this particular branch or any particular type of personality students
Okay.
has avoided or want to avoid, like.
Yeah, I think this is very important. Uh, Means because one thing, we need to be very compassionate, very empathetic, and usually females are more compassionate than
Yes.
so it's bit more easier for maybe like might more suit them than males, and that's the reason most of like 70 to 80% of consultants right now are females. So it might suit them more. They better handle emotions than men. That's what I can feel. About the personality, as I said earlier, if you are not very patient, or if you feel handling emotions is difficult, because I know, like, many of us cried during our conversations with patients and family members. Your patients dies, maybe in few days or 2 months, or those many times. So if you are not, if you feel you are not comfortable with these things, handling soft skills, then this may not be a branch for you. But if you feel like if you want to be a good, more humanist doctor, then definitely this branch will be more helpful for you.
Okay. Okay. So totally, I'm understanding that if the person is with like patience, have patience and empathetic with the familiarity in the society, they can totally relate with your branch. So, sir, my next question from you is that how you see this palliative medicine in the after 10 to 20 years in the particular branch in the future's perspective side?
It's very difficult to say right now, but definitely in last 10 years it has grown a lot. Means 10 years back, because there were no MD seats, so none of these consultants used to know about what is palliative care,
Yes.
except for oncology centers. Now it has grown to corporate house. People have started their own clinics in palliative care. So in last 10 years, and yes, the NMC is recognizing it as a specialty. Um, uh,
Yes.
um, like at ministry also, there is national program for palliative care. And as I said, like in the the CBME, the competency based medical education, they have also included palliative medicine. There are a lot of lectures that need to be there from palliative medicine side. So the acceptance is coming out. And when I was in Manipal, a lot of people, they were settled either in UK or US, so they used to ask for palliative care from their side, like from the patient side, because there was
Yes.
awareness about palliative care. So I feel in next 10 to 15 years, more people will be aware about palliative care. As like now incidences of chronic illnesses has increased, and in palliative care, we are dealing with palliative with chronic illnesses, and basically people want themselves to be more happier, or they want a good quality of life. So
Yes,
these
exactly.
concept of palliative care will be more taken with the patients. They will be demanding for palliative care.
Okay. And so many of our viewers are just about to take multiple specialities and they are just turning up with the round one counseling from this year too. So, sir, if the individual want to take palliative medicine as a future branch, so what is your, what things to be considered before choosing any particular institute, or you just share some institute which are best for this particular branch?
Yeah. So one thing is the first and foremost thing: choose very wisely. Palliative medicine will definitely give you a very good career, very good opportunities, but you need to understand yourself whether you fit into it or not. The training, your trainers or your teachers will teach you how to handle the emotions. If you feel like if you are too weak into it, they will teach how to communicate, how to handle these emotions. Those all things you will be learning. But if
Yes.
you feel like you are too means this does not attract you, working with people or their emotions or their family members, then maybe you should not choose this branch. Uh, but there is a lot of medical things you need to handle. The emergencies, the patients will come with pain crisis, with electrolyte imbalances, with infections. So a lot of acute palliative care you need to provide them. So there will be a good medicine exposure. You will be posted at least for 3 months in Department of Medicine. You will be posted for with neurology, with nephrology, with medical oncology, radiation oncology. So you will get a good exposure about the medicine. You can handle those medicinal emergencies. Nowadays, most of the centers are offering interventional pain training also.
Yes.
So that the one thing where you can do some interventions. Otherwise, all other interventions like lumbar puncture, ascitic tapping, pleural fluid tapping, these all things are taught in palliative medicine. But these things varies quite a lot between institutes and to institute.
Okay, matlab kind of mix branch we can see, like you have just enumerate things about the part of neurology we can get in the experience, part of the anesthesia we can see, part of the emergency medicine we can get all the combined exposure in the palliative care. Okay, sir. So, sir, any particular recommendation from your side about the colleges to be
Yeah.
prioritized in the list?
Yeah. So right now, I think around 7 or 8 medical colleges offer MD in palliative medicine. My first and foremost recommendation would be Tata Memorial Hospital and then AIMS New Delhi. And if money is not a problem, then the first place would be Manipal, because KMC Manipal has a very good learning opportunities. Although they have started MD just 2 years back, this will be the third batch, but they have like verticals, renal palliative care, nephrology palliative care, and pediatric palliative care. These all things you will get exposed. So these three are the best institute, if you ask me, for MD. But otherwise, Amrita Kochi is also a very good, means that was the first institute to start fellowship in palliative medicine. GCRI Ahmedabad has a very good load, and also there you will be exposed to interventions and all. Then Jaipur, SMS Jaipur, and the Ajmer Medical College. These are a bit new, but you will get exposure to the medicinal part of palliative medicine, a good exposure to medicinal part. About the DMD, all these institutes are bit new to offer DMD, but personally, MNJ Cancer Institute is excellent. That's in Hyderabad. Indo-American Cancer Hospital also, that is also a good institute to do MD. Otherwise, yeah, I forgot the St. John and Adyar. Means that are these two institutes are also very good, especially the St. John, Bangalore. They have recently started a DNB in palliative care, but they are doing a lot of good work. Means definitely, it is very much recommended.
Okay, so sir, as you just shared the list of the colleges, so students can prioritize the list as per their requirement. I hope we have, sir, got maximum information, and we have tried to reach out all the basic and most frequently asked questions from the students, and we have tried to dig out as much as information from you in the branch of palliative medicine. Sir, anything special or particular message you want to share with our students that they should be taking before any branch?
Yeah,
Special
so
message.
definitely. The first thing that they should remember when choosing palliative medicine, the palliative medicine is not only end of life care, not only holding hands, or not just communication. It is a lot of medicine is involved. You need to have a good knowledge of the pathology, pharmacology, and medicine when we are dealing with palliative medicine. It has a great career opportunities if you find yourself suitable for palliative care. But at the same time, you need to remember that you need to lead a team where you will be dealing with nurses, your colleagues, and those all things. A lot of your patients will depend on the referral pattern, so you need to maintain a good relations with your colleagues also. And there is not endless money. Like, there is good money that you can survive, you can live with dignity, but not like in crores. That's not like there, but you will be earning better than your most of your colleagues. So that is about palliative care, but it's a good branch. Means I'm really satisfied with this, with my decision. And I'm sure if you choose correctly, if you find yourself into palliative care, you will definitely be happy.
Okay. Okay. Thank you so much, sir, for giving your valuable time. I hope you have answered all the major questions which generally many students ask. If any students have any questions, please feel free to type in the comment box. We would love to answer your questions. And if you have any special message, please put out in the as a feedback of our interview. Thank you so much, and thank you so much, sir, for your valuable time. It's my pleasure to have you.
Thank you, Vidit. Thank you, Dr. Vidit, and thank you for this initiative. It's really great.
Yes.